Good afternoon and welcome to Virtual Part 2. My name is Maddie.
I'm Matt.
My name is Ronak.
And I'm Sophia.
Virtual stands for Vitalize, Innovate, and Research for Telehealth Use and Artificial Intelligence for Life. This year, because of the coronavirus, we have propelled our project in order to include pandemic technology, hence the name Virtual PT2. Virtual, now with pandemic technology 2. Our new normal. Social distancing, masks, quarantine, and chaos. Yet through all of this, what is the one thing that has stood by us this entire time? Technology. It has always been there for us, yet it took a global pandemic for us to see it. For instance, many people didn't even know about the app called Zoom until COVID-19 impacted us this year. Now there are over 300 million users and 1.2 billion students using it every single day. For instance, in the medical world, nanomedicine is used and explored by drugs, wound repair, cell repair, and much more. Larger nanotechnology was further put to a halt in order to further the research of the coronavirus. We know the main reason we are here is because of telehealth. As hospital rooms began to fill up with many different sick and infected patients, others had nowhere else to go. We now know that telehealth is a life-saving technology, and it is here to stay. Now I'm going to pass it on to my colleague Matt, who will talk about the implications of cardiology.
Thank you, Maddie. Now, the question on all our minds is, what is telehealth? Well, telehealth is a virtual platform that offers health services to people across the globe. Before the pandemic, telehealth was reserved to be used in emergency purposes only and was considered a secondary to in-person medical consultations. It was used in special portals and was not widely available before the pandemic, but when COVID hit, physicians took this opportunity to utilize each and every aspect of wireless communication, such as Skype and FaceTime, without any restrictions. It allowed for the widespread use of telemedicine, redirection of limited funds, and enhanced access to virtual healthcare. But the rise of telemedicine also shed light on a very critical limitation that will be further discussed by my colleagues. Telehealth's main resource is artificial intelligence, and incorporating artificial intelligence with telehealth greatly improves access to care and has become the new, preferable form of health management during this pandemic. A perfect example of artificial intelligence would be the Blue Dot application. It now predicts humans in finding infectious diseases and help locate patients in Wuhan as early as December of 2019. It can also act as a public health tool and predict the course that a virus can take. It accurately predicted the course the Zika virus would take in its outbreak in 2015 and is actively monitoring the coronavirus. To further expand on this model, these predictions are then taken and mapped for easier interpretation, keeping information on H1N1, SARS, swine flu, and now COVID. There's a global urgency to try and create the best blueprint for virtual disease tracking. Artificial intelligence is also responsible for drug discovery and diagnosing a patient long before COVID. So as of right now, it's being recruited all across the world to come up with a vaccine for COVID and give repurposed existing drugs. And lastly, Blue Dot also uses thermal imaging scanning to scan a populated area such as unauthorized crowds, gatherings, parties, etc., and locate public health threats and thus reduce the risk of exposure. Part of our artificial intelligence platform includes important educational information about how COVID increases mortality, because COVID is not just a respiratory disease. In fact, 70% of all deaths amongst high-risk patients, Hispanic and African American communities alike, are cardiac related. COVID causes a profound inflammatory response, causing clots to form throughout the entire body, including the heart, which directly leads to myocardial infarction, a heart attack, congestive heart failure, and dangerous arrhythmias, which can potentially lead to cardiac arrest. Let's face it, our new normal is dealing with pandemics, and COVID-19 has shown us firsthand that our methods for fighting a virus are inadequate, and that we need artificial intelligence in order to maintain our health status amongst future endeavors. And with that being said, I'd like to pass it off to my colleague, Ronak.
Thank you, Matt. So through SCARF, we were able to sit in on multiple telehealth conversations with the nurse practitioners, and we were able to assess the benefits and the drawbacks of telehealth. The main drawback of telehealth is the lack of a physical exam. My colleague Sophia will further elaborate on this. Next, telehealth imposes a great financial strain on the patient, as the telehealth kits being used today are very expensive. Telehealth also requires that physicians be retrained in using each unique telehealth platform to best serve the patient. And finally, telehealth inhibits proper patient communication, as the patient may not pick up the phone, they may be distracted, they may have poor connection, or they may provide incorrect vitals to the physician. On the other hand, telehealth has many benefits as well, the main benefit being enhanced accessibility. Telehealth is increasingly accessible in rural, disabled, and lower socioeconomic communities. This is important because those communities may not be able to travel to the healthcare facility, or they may not be able to afford traditional healthcare. Telehealth is also now being used in remote monitoring, which is especially important in isolation care during the pandemic. In order to reduce infection rates and to keep the physician safe, the physician now implements telehealth to monitor tens of patients at the same time without being in the same room as them. Furthermore, telehealth promotes physician collaboration across the nation, as now thousands of physicians are able to work together to come up with complex solutions to complex problems. And finally, telehealth is able to be rapidly deployed across the nation in emerging epicenters during the pandemic to care for less critical patients. Overall, COVID-19 has had a significant impact on telehealth. In fact, in the past months, telehealth has increased by 3,300-fold, and it's expected to increase by 18.4% every year here on out. On top of that, telehealth is now shifting from a rural to an urban setting to reinforce social distancing guidelines. And finally, telehealth is now receiving additional funding from the government, as the FCC has just launched a $100 million initiative to increase telehealth reach across the nation. Thank you. Now I'd like to pass it on to my colleague, Sophia.
Thank you, Ronak. So it's very clear by now that telehealth is here to stay. By taking this mainstream, we can maximize its efficiency. And with that in mind, we present our tele solutions. Starting with disease outbreak tracking. The telehealth platform can streamline fragmented data from all regions, making it accessible while creating predictive models on outbreak mapping. It can also serve as a highly centralized source for health education and can optimize patient-centric services by guiding patients to take control of their diagnosis, treatment, and outcome with the help of their physician. There can also be rapid emergency management tools within the actual platform, so in case of an emergency, there are immediate action functions that can be used to intervene. Think of an automatic 911 call. And finally, mobile telecommunication, where mobile devices are the primary method of telehealth management, thus making it more simple and universal for all patients. But despite all of these advancements, telehealth still has its limitations, and that's due to the lack of the physical exam. Take a patient complaining of chest pain. All the doctor has is subjective data from the patient, heart rate, blood pressure, and temperature. But to fully evaluate these chest pain symptoms via telehealth, there needs to be a real-time physical exam. Along with vitals, O2 sats, and an EKG, the doctor needs to listen to the patient's heart and lungs. And without this information, this telehealth consult can easily result in a visit to the ER. So this year, the virtual team has done extensive research on home diagnostic equipment and telehealth kits, and we hope to make this the marker of our initiative. If you think about purchasing a phone, the bare device is not enough. You need a screen protector, a charger, a case, and all the accessories necessary to optimize the experience of using that phone. Likewise, just talking to your physician over the computer screen is not enough. You need the accessories to complete the consult. Patients will have a home blood pressure cuff and a thermometer at the most, but we envision a telehealth supplemental kit that is widely available, simple to use, and cost-effective, just like a phone case. So in this sample kit that we have here, we have a blood pressure garment, a wireless EKG monitor, and also a pulse oximeter. On top of that, we're also working here at SCARF with Dr. Ray Hall to modify the basic stethoscope so that when the patient applies this tiny stet onto their heart, the doctor can listen to their vitals right away on their own phone. And all these devices would be synced up to the telehealth platform so that it'll feel like the doctor is reaching out of the computer screen to conduct the virtual physical exam. At the 2019 symposium, we predicted that slowly but surely, telehealth will become more prevalent in healthcare. But never did we imagine that in a matter of months, that would come true in the most chaotic way our world has ever seen. Telehealth was always there for us, only now do we see it. So now that it's been proven to us, we know more than ever that the future is virtual. Thank you.